There we go. Okay, so I think most of you guys have joined. If you haven't joined the Menti yet, please go ahead. How do you guys like those osmosis videos that I've been showing? Feel like they're pretty helpful? Yeah, okay. I've included a couple more today about heart failure and hypertension because I really do like how they show everything. So let me click back in my. All right. So we're just going to go ahead and watch another one on hypertension. So let's see. Will it play?
Body of evidence that shows
So out of that video, what are the things that kind of stood out to you?
That 1 billion people in the world, hypertension.
Yeah, isn't that crazy?
That only 10% is like a known, like a secondary.
That they're actually
Yeah, or-
diagnosed?
Yeah.
Yeah. Silent killer, I heard somebody say. Yeah, I used to do blood pressure checks at our local farmers market. And it really shocked me how so many people would be walking through with high blood pressure. I mean, I would be like, it'd be like 160, 170, over 90, 100. And I was like, wow, like, tell me, like, do you have high blood pressure? And they'd be like, no. I'm like, well, it might be good to like go see your doctor, right? Like, there's so many people. Yeah, go ahead.
Sometimes the doctor is like my doctor's office.
Hmm.
Maybe when I go in, the nurse, she always does my blood pressure manually,
Yeah.
and I don't think she knows how to do it.
Ah,
Because every time she's like 117 or 112 over, and that's not my number.
That's not usually.
130.
Interesting.
So,
And if on the other side, have you guys heard of something called white coat syndrome? Yeah, so that's typically when patients you're nervous. And so you go into the doctor and you don't like needles, you don't like medication, you're nervous, whatever you're going, and it caught that nervousness, the stress drives your blood pressure up. And so we've seen in the past people who consistently have high blood pressures, but they're only high in the doctor's office. Because that's where the doctor's checking them. Sometimes they've been put on antihypertensive medication, help keep their blood pressure down. What do you think happens when they take the medicine and then they're at home? It goes too low, right? And so sometimes what we tell patients, if we don't think maybe the number's right, high or low, what I tell my patients is when you're at Target or Walgreens or Walmart, or there's like blood pressure checks, I think even at the YMCA, they have them, like maybe not after working out, but like when you're just kind of relaxed sometime, take your blood pressure and maybe do it once a week consistently for a month. And then you bring that to your doctor because that's going to give you a better baseline of where they're at. Yeah.
So we'll get a lot of phone calls at work and it'll be like, your patient is here at the dentist. We can't do treatment because their blood pressure is high.
Yeah.
So they need to meet with their physician, get like a note that says, here's their blood pressure, but it's like really common.
Those poor patients, because they're nervous about going to the
Yeah, about
dentist.
being at the dentist, and that's probably exactly what it is. So, I mean, I don't like the dentist.
Oh, yeah, same. All right, so let's dive into hypertension a little bit more here. I really like the video of how it kind of explained hypertension and how it affects people. So just so we know like what blood pressure is, it's the pressure that the blood exerts on the blood vessels themselves. And so I actually have a little like toys for us to play with today. So don't use them yet. Just kind of, so when you talk about the blood vessels, the blood vessels are part of this pump system, right? The left part is the pump. Oh, we have some extra. There we go. I think everybody has enough. So when we talk about the pressure, like what we're measuring, it's calculated by a few things. So when you look at this, like the cardiac output, what is the cardiac output?
Oh, yes, in the definition.
It's not what your heart is doing out.
Either it's more just kind of in general if we know what it is. There is a calculation to how to or what's that called, a formula how to calculate that. But really the cardiac output, that's how much your blood is pumping out, from which chamber? Left ventricle, right? Left ventricle is what pumps out to the body. The right ventricle pumps into the lung. Gotta remember the blood flow. So peripheral vascular resistance. So we think about if our heart is this pump and the blood vessels are all the tubes that it's pumping through to come back. If there's resistance, that makes it harder for that pump to push back. So take your balloons that we have, right? So now what you've been waiting for, like think about these balloons kind of as the vessels that you have in your blood. So go ahead and try to blow up. Depending on what kind of balloon you have, it might be a little easier or harder. Somebody had like a real little balloon. Anybody? Maybe nobody got that one. Yeah. Jade, lucky you. Would you try to blow up that balloon?
What passed out?
Okay, but think about this. It's littler, it's tighter. Is that more difficult than the bigger one to blow up? Yeah,
Yeah.
right. So if you think about, these are kind of like our blood vessels. If we have a blood vessel that's either smaller, it's tighter, it's not as stretchy, that puts more pressure on Jade. She can't, she has to have more pressure to blow up that balloon. That's kind of what our heart does. When our blood vessels become damaged, either they get scarred and tight, they're not as stretchy, or if we have plaque that builds up inside of them and it makes them actually smaller inside, that means that our heart has to overcome more pressure, has to push harder to get that blood to go through. So, yeah, go ahead.
That was the blood pressure, right?
Yeah, exactly. So the blood pressure would, excuse me.
And it would
Exactly, exactly. Yeah. Yeah. So that pressure goes up as you have to, like, as the blood vessels have more resistance to them, the blood pressure goes up to overcome that resistance because it needs to get out to the rest of the body. So the blood vessel stretch, like we talked about, that's part of what it attributes to blood pressure. Blood viscosity. Did the video talk about that? I don't think it did. There's another video I wanted to show you. And the example was if you had a big stack of pancakes and you took like some thick maple syrup, the maple syrup would come out and it'd be kind of thick, right? And it would eventually spread all over. If you took a glass of orange juice and dumped that on there, what would happen? Right? Because the viscosity is different. It's a thinner type of liquid. So when we think about our blood, are there times when our blood becomes maybe a little bit thinner or thicker? And not necessarily blood thinners, because I know that I was just thinking that's going to be a little bit tricky. But yeah, hydration, right? So if we are dehydrated, our blood is going to be more concentrated. It's going to actually be a little bit thicker. You have certain diseases that maybe cause you to like overproduce red blood cells or other things. They're going to make your blood actually be more viscous, more thicker, which means it's going to be harder to push it through the blood vessels, right? So if we're well hydrated, that's also going to make it a little bit easier to go through the blood vessels, right? And then the blood volume. So just like somebody was saying, if you're dehydrated, you know, like if we talk about our heart being the pump and we're pumping through all these blood vessels, if that amount that's in there isn't very much, right? Like if Jade, sorry, you're my example today. If you get lightheaded from trying to blow up that balloon and all you have left is just a little bit to go, that volume that you're pushing out is very small. So the pressure inside that balloon is also pretty low. So the volume of blood, if you are dehydrated because you've lost blood, you don't have enough liquids that you drink, any number of things, that can affect your blood pressure. Kind of makes sense how all these things play a part. It's kind of interesting because when we have patients come in and their blood pressure is out of whack, I was like, what's causing it? What's the deal with you, right? Because it can be, yeah, it's a puzzle, right? Like what causes all of it? So these are some of the categories. This stage 2 blood pressure, this number used to be higher. But what we found was when we let people go with 140 or more, it actually was causing some damage to their blood vessels, which caused more issue. So what we found is if we identify people whose blood pressure is a little bit elevated earlier and we treat it, then it helps them from getting that damage that happens long term. What's the first line of treatment that we do for these patients?
Life changes.
Yeah, lifestyle changes. What are those types of, like, what does that mean?
Exercising, diet,
Exercise,
not
diet,
smoking.
smoking, right? Smoking is
Or
huge. Alcohol, it's already on here. No, okay. I was like, oh man, I always do that. I always ask you questions of something that's on the slide already.
Yeah.
With the diet, you guys answered a lot over here, so I want to hear from this side of the group. What are some diet changes that we have for patients? Low sodium.
Right.
Have lower fat. Mediterranean diet. We're gonna talk about the DASH diet, and that, and actually it's still a big one. That's dietary approach to avoid hypertension. I don't know why my hands did that. That's not sign. Me trying to remember. But it's all talking about how do we help people to lower their blood pressure through their diet. And with a DASH diet, you lower the sodium amount, you increase your fresh fruit, fresh vegetables, you try to limit your fat intake, eat more whole foods overall, and that really does help treating hypertension. So I like the video kind of described, it can be primary or secondary, which means secondary, what might be a possible cause, like what can be secondary hypertension? Renal failure, right? And I'm so sorry, what did you say, Sarah? Lifestyle, but usually it's, when we talk about, and thank you, I'm sorry, I'm not picking on you, but like usually your lifestyle has caused another disease, and that disease has caused the high blood pressure. So renal failure, very common. Maybe hypertension, not hypertension, maybe uncontrolled type 2 diabetes, right? Because we know that can affect some of the blood vessels and any of that. There's a lot of other diseases that then, because of that disease, that has caused the hypertension. The primary hypertension is just somebody walking around, they don't have anything that's necessarily caused it. It's just there. I will say caused it, it's usually genetic as well. So there are causes as far as like you can trace that back with families who tend to have primary hypertension, but there's not something medically that we can say, oh, this would happen to this, and now you have hypertension. It just kind of pops up with them. So known as that silent killer as far as the signs and symptoms, because they don't have any. Most people just don't know. There are rare signs of headache, bloody nose, anxiety. That's usually late stage. That's when their blood pressure is like usually in that hypertensive emergency that the video talked about. That's when your blood pressure is way too high. Like the bloody nose, that's because you're bursting blood vessels in your nose because the pressure is too high. So it has to get really high before people start having signs and symptoms. I'm carrying my water bottle like a baby today. Okay, so let's talk about risk factors. We already did a little bit of lifestyle changes. Questions? Okay, non-modifiable. If you didn't read the slide, what's a
It's
non-modifiable?
like, that's just gonna be your age, your gender, your ethnicity, anything that you're just born with that you can.
Right, you can't change. And I like that you brought up age too, right? Because as we age, our bodies start to break down, right? If you're over the age of maybe 30, I don't know, maybe your knees have started to feel a little bit different.
Mind it.
You're like, wow, that running or jumping I used to do, it doesn't feel the same. Over time, our bodies don't function the same as they did. The same is true for our heart and our blood vessels. So our blood vessels over time, they do get kind of stretched and stressed, and they don't expand or contract as easily. That's a part of the normal aging process. That's happening, chances are they can also have increasing blood pressure that happens with it. All right, you guys talked about non-modifiable. Remind us over here this side, what are modifiable risk factors? Exercise, diet, smoking, yeah, all those things. Stress reduction. Sometimes it feels like, how could that possibly be modifiable? And really, your patients are right when they say, how can I reduce my stress? And I always like to think of trying to encourage the mindset of we don't have control over the situations around us always. Sometimes we do, but not always. What we do have control over is how we respond, right? And so we have the ability to hopefully step away or just have learned some techniques to learn of how we deal with that stress. All right, we talked about this, talked about this. I already asked you guys this. Let's go ahead and do it anyway. The nurse would include which of these as a modifiable risk factor when looking at the patient teaching plan? Yeah, and you guys, absolutely correct. Good job. You were listening. We got it. So age and family history, non-modifiable, right? We can't choose who our biological parents are, and we can't choose to slow down aging. So like, they went to homecoming this weekend and they're getting so old, and I kind of wish I could slow that down a little bit because but we can choose our diet, how well we can control our glucose, and to work on weight. If you're overweight, you are more likely to develop high blood pressure because of various stressors that it does put on your body. We talked about that. Okay. So the nurse evaluates the patient as understanding nutritional teaching to manage hypertension if the patient made which of the following statements. So real quick, this is one of those test-taking strategy questions. What is the question actually asking us? Is it saying what is a correct statement or what is an incorrect statement? The correct statement. A lot of times we're taking our tests, it's easy to kind of skim over these and forget that it's asking like what is it really asking you? So make sure next week when you're taking a test, look through what is this actually asking us? And you guys, so good. Yes, the correct statement would be follow the DASH diet. That's a good approach. We don't want them to increase their sodium. We don't want them to limit their fluid intake. What would that do? Make it more viscous, right? It's gonna make them more dehydrated, or the blood's gonna be more concentrated. It's not gonna flow as well through the blood vessels. And we do want them to limit their. Okay, so first, we're gonna talk about lifestyle changes. That's what we do first with everybody. Then, if that doesn't work, then we give it a good period of time. Each patient is different, each provider is different, but you want to usually give them a few months to let that lifestyle change kind of start taking effect. If that doesn't take effect, then usually we start them on some anti-hypertension medications. I was going to get more into medications today, but I decided not to. I'm going to wait to really dive into cardiac medications until after the test. You guys have enough to study for. So moving on. What should the nurse include in the patient teaching plan to prevent falls when taking a hypertensive medication? Stand up quickly, always. Excellent. You guys, good job. So these are all really good interventions, except for the stand up quickly. Remember, as we change position, our body does a really good job of adjusting, like, tightening blood vessels, opening them, as far as making sure the blood is distributed appropriately. But gravity is gravity, right? And if we stand up, there is going to be a little bit of a shift. Our brain gets a little, whew. And so if we're slower about those transitions, if we're getting help, if we kind of sit first and kind of let our bodies settle, that does let our bodies kind of gradually adjust a little bit more, especially when people are first starting these antihypertensives, because they're used to a lot more pressure, right? And so when they get up, they still have a lot of pressure to maintain what what they need. If we're lowering that pressure, that's also going to lower that pressure when they stand up. So we need to remind them to give time. So the nurse evaluates the patient as understanding hypertension therapy teaching if the patient states hypertension must be managed for which time frame. How long do we need to manage hypertension? You guys are good. Has Chuchi given you her clinical talk already? I think she did that one of the first weeks. I think there was a slide that I think is so funny when you say, hey, what medical conditions do you have? And the patient's like, none. And they're like, oh, but you take lisinopril and hydrochlorothiazide and metformin, and you're like, they're like, yeah, because I don't have hypertension when I take my lisinopril and hydrochlorothiazide, and my diabetes is under control when I take my metformin. And so sometimes there's some education about, even though you might have your disease controlled with the medication, you still have that disease. And by process of having that disease, it does make you more at risk. Even though you are controlling it, we just still need to know about it. So complications, high blood pressure can cause so many issues, because think about that pump and all those blood vessels, right? They run through every single part of our body. That's like the highways, the byways, the back roads, the alleys. They're delivering that blood, nutrients, oxygen that we need. And so everywhere that those blood vessels go can get damaged, right? So we talk about like our eyes, right? You can have damage to those little vessels in your eyes, and you could have vision problems and even lose your vision from having high blood pressure. We talked last week about kidney damage from high blood pressure. It damages those blood vessels. The blood vessels, sometimes we forget, our heart has blood vessels in it, right? The heart is a muscle. So as it's pumping, it's also pumping blood to those vessels to feed the muscle of the heart. So when you have a heart attack, usually it's something that's going on that's not feeding the blood of the muscle of the heart. Maybe those blood vessels have gotten clogged, or have an issue. Or even a stroke, right? The blood vessels in our brains. So hypertensive urgency. It's a little bit different than hypertensive emergency. Couple of things. Usually, we talk about urgency when you have really high blood pressure, but not high enough where it's causing organ dysfunction. It's not actively damaging your heart, your brain. You can have some pretty gnarly side effects. And remember, we talked about like that pressure, right? It's the headache, that bleeding, you're popping blood vessels in your nose. And usually ambulatory treatment, which just means outpatient treatment, can be effective. I'm going to postpone this. And you give them an oral medication. So if somebody comes into the doctor's office and you're working there as a nurse and their blood pressure is really high, you're like, oh, I think this is hypertensive urgency, or maybe the doc says this is urgency. You're gonna make sure we give them medication or prescription. We're gonna teach them. One thing I want to make sure we teach them is, if it's outpatient, when do they need to fill that prescription? Like, when do they need to start taking the medicine? Today, right? It's not something that they can be like, oh, I'll pick up tomorrow and start tomorrow night. Like, no, you need to start it right now. You know, and we're probably going to do some teaching, but do you have a blood pressure cuff at home? Do you know how to check your blood pressure? Because we're going to want them to follow up so we can see how they're doing. Now, if you have hypertensive, clicked off the screen, it always does that. If you have hypertensive emergency, that's when your systolic usually gets greater than 180, the diastolic greater than 120. And that's when we start having risk of it damaging your organs, right? And so that is where you need immediate medical care. If they're at your doctor's office, you're going to be sending them to the emergency room, because at that point in time, you really need to get that blood pressure managed. And when I say managed, usually they start them on some IV medication. But if you had to guess, do you think we want to drop that blood pressure fast or slow? Slow. I'm gonna go slow. Part of that reason is, if you think about, let's just talk about the brain and its perfusion, how it gets blood. If that pressure is so hot, right? Think about our balloons, right? They're filling up a lot of pressure, and all of a sudden we drop that really low. Our brain's not going to be able to adjust to that low pressure. We need to give it time so it gradually goes lower. In fact, when I work with these patients, when they come into the ER with hypertensive emergency, there's usually orders that will say, you know, maintain the blood pressure. You know, if they came in at 220, they're going to say, keep it between 160 and 180, like the diastolic pressure, or systolic, excuse me, because they don't want to let it go so low. And then maybe in a day or two, the doctor will change the orders to say, hey, now let's try from 140 to 160. We're going to kind of target it to gradually decrease that blood pressure. Bum, bum, bum. All right, next question. Which of these nursing diagnoses is appropriate for a patient that has new onset hypertension? And they want information. You guys did well. So yes, they're asking for how they can control it. So that's readiness for enhanced health literacy. Now, depending on their past or what they've been doing, they might have ineffective health management. When we look at what's the most correct answer, we know they're asking what they can do. That means that they're trying to learn. It's readiness. So that's the one that sticks out as being most right to me. Other nursing diagnosis, risk for unstable blood pressure. That's one. So when you guys go out to clinicals pretty soon, and you might have to start looking at what are some possible nursing diagnoses. Somebody has high blood pressure, risk for unstable blood pressure is a nursing diagnosis you can use for that. So we talked about lifelong control, medication therapy, and we always remind them, even if you're feeling good, even if like you're like, hey, I feel better now. It's just like antibiotics. You take it till it's done, and it's never done for blood pressure. It's kind of forever. I will say, if somebody is also implementing lifestyle management and they are very overweight, they haven't exercised, and now they're also, all of a sudden they're like, wait, I do want to exercise more. I do want to start losing weight. I do want to get my glucose under control. I have seen patients who've been able to decrease their blood pressure because, or their blood pressure and decrease the medication they're on because all of their lifestyle changes. Eventually, it was like, oh, wow, you lost a lot of weight. You're eating really healthy. You're exercising regularly. That's had such a good effect on your body. You don't need the same blood pressure medicine. So lifestyle changes, they still can, even if they're already on blood pressure medicine, we still want to encourage that. We still want them to have that to be healthy. Bum, bum, bum. We want to teach them that giving them that medicine, it can cause low blood pressure, right? We want to make sure they know how to monitor for that. We talked about the rising slowly, make sure they're hydrated. A lot of the medicines that we give to treat blood pressure or high blood pressure are diuretics that make people urinate more, right? And so we want to make sure that they're drinking enough water, they're keeping hydrated. All right, so quick question. As you're walking by Miss King, a resident who's 84 years old, she gets up from the chair to go to the dining room and says, oh my, I feel dizzy. And then she slumps back into the chair. She takes hypertension medicine. So turn to your neighbor real quick. What do you do? All right, let's see what Emily David says. So one, go to her and make sure she's safe. Don't just keep going. We want to ask her, how are you feeling? Let's get a blood pressure. Let's get her teaching about rising slowly. We're gonna say that she jumped up, but we're going to teach her about how to change positions. And then we're probably going to talk to the healthcare provider. We're going to let her doctor, nurse practitioner, whoever's following her know, hey, she's getting kind of dizzy, because they might want to evaluate what medicine that she's on. She's a fall risk. Data collection. We already talked about that. Okay, so CUS communication. You guys remember CUS from MedSurg1? It's the what does it stand for? It's about being concerned. Okay, let's just look together. Let's learn. We say, I am concerned about her dizziness. So it's about these cue words to use. I'm concerned about her dizziness. I'm uncomfortable with her current status. And I believe she's not safe, that she could injure herself with a fall. if we had a recommendation, this is great where we could go into our S bar and start saying, you know, hey, like, where do we go with those recommendations? Do we recommend we hold her blood pressure medicines this morning until we kind of can evaluate her? What else? What would be a good diagnostic tool that we as nurses could do? What's something that might be able to diagnose what's happening to her, that it's not a doctor's order, that, but that, or do, yeah. It's a type of assessment, kind of. How about orthostatic hypotension, or like the, what's that called? The, yeah. That's something that we can do as nurses is, you know, take their blood pressure. What's the first position? Lying down flat, sitting, and then standing. And that data is gonna let us know, you know, hey, is your pressure dropping pretty significantly? That would be really good data that I'd want to gather before talking to the provider, because that is objective data, right? It's kind of subjective that she says, I feel dizzy, you know, but objectively, I can say, I took the blood pressure and I can see that the numbers are dropping. That correlates with what she's telling me. Okay, moving on. I don't want to do this concept map. So what I do want to do is our group work for hypertension. So where are we at? Let's do our group work and then we will go to break. So you've got a group. Again, the bag of equity, everybody will get a group. And this is and what we talked about, this is the group project.
For over an hour because. Here. Yeah. Anybody else?
Okay, so go ahead and get into your groups. You should have same as last week, 2 yellow groups, 1 blue, 1 purple, 1 pink. Looks like pink diamonds are over here. Do you guys need candy already? Do we need candy? Here.
Yes.
Come, candy to have in your groups.
Yes. Oh, I was really nervous when I was out, like I did that right there before. Yeah, no, so it's about a lot lighter. I did not think about it. Like 40 developer on it. Oh, I like you.
Yeah.
Yeah.
But I'm sure it's gonna be bad, but.
Right.
Don't come in like her.
Hers coming.
You getting me one?
Purple?
Yeah, there's a purple group.
Oh, yeah.
All right, so I want to explain a little bit about what we're doing and how it relates to the group project. So in your homework for this week, you already completed a case study. Well, pretty much in one of your in the hypertensive review. Bum, bum, bum. This is kind of a continuation of that case study. So here, for this group project, we're gonna be doing most of the work here in class. This is the student learning outcomes it addresses, which is really just the class outcomes. What we're gonna do is that you guys have all read the chapter 6 about hypertension. We're gonna complete this worksheet in class. And then I'm gonna randomly select you guys to answer one of the questions from this worksheet. There should be 6 questions, there's 6 groups, it works out. Then when you go home, you're gonna answer these questions. And so I suggest you take notes as we talk, because this, I have to score you guys kind of individually with this. So at home, you're gonna write a reflection that says, hey, how does hypertension affect the body? Please make sure you list 3 ways that it's different from normal function. And you don't just say the blood pressure is high, you would say, how is it different? Like, it's high, the blood pressure is higher, what number is it? How is that different from normal? Normal blood pressure is this, right? So you do want to make sure you describe what the normal is for it and what the abnormal is. So 3 different ways. You're going to describe at least 3 treatments or therapeutic measures for patients with high blood pressure. You're going to identify how a member of the multidisciplinary team can contribute to care. And you're going to list at least 3 of them. And then identify 3 educational needs for the patient and how you would educate them. Describe 3 ways a nurse would educate the patient or would evaluate the patient's education if it was effective, and describe how a nurse would respond or should respond in a potentially unethical situation. So I know that sounds like a lot. You don't have to do that right now, but keep those things in mind as we're talking about these through the group, because I think a lot of the answers to this is going to come up as we work through this. So I'm going to give you guys, let's do 5-10 minutes. Let's do till 9 o'clock, and then we'll share answers and go on break. How's that sound?
Which time, but we just need one more.
Does anybody have an extra copy?
No allergies.
Yeah, I'll bring that another one.
So I didn't say what I feel from I put the team as it's a lot of salt. The only thing that's a little confusing though, when her having her, she has that she does have to be added in order to be causing high blood pressure.
Oh, yeah, I was like,
Eating appropriately, 3 meals a day with snacks.
Yeah.
Moderate.
yeah, with-
Then, so that's like all the time.
Yeah.
Somebody else.
and lows of it, depending on what you need.
Like she's.
Oh, yeah.
I don't think you're lax monitor. I guess me.
And I need to give us stuff. Oh, you can see gender. Cause she's, that she's a female.
Oh.
Yeah, this is second.
What I read in the end, I see that. I go inside. I won't
Okay, now we're recording again. All right, so again, I think this is another video about heart failure. So let's dive in. This one is a longer video. I am going to skip part of it because it gets a little bit in the weeds in the middle. All right, what stood out to you about that video? Yeah, and because even if somebody starts out, like we said, in left-sided heart failure, a lot of times they're gonna develop right-sided heart failure. It's one big pump, and you don't have one that functions poorly and have it not affect the other side. So they are very similar. What are some of the big symptoms we see with heart failure? Dyspnea, cough, edema, fatigue. Why are they fatigued? Yeah, perfusion. A lot of times they have that congestion, the fluid build up in the lungs. They're not able to have that good oxygen transport like we'd like to see. And so they're not getting as well perfused as we'd like them to be. Heart failure, when we talk about it, sometimes we really talk about it as a syndrome, meaning that it's not like something that happens right away. Usually chronic heart failure, especially, is gradually onset, right? Your heart doesn't go from normal function to absolute dysfunction overnight in most cases. For chronic heart failure, it slowly occurs. We sometimes used to call it congestive heart failure, and if I fall back into that, forgive me. The current term is just usually heart failure. Congestion is like a lot of times you see that in the pulmonary system. You don't always see that, but so causes, like I talked about, we have the coronary artery disease, right? The heart's blood vessels itself aren't functioning well, especially if they cause an MI and it causes damage to the muscles of the heart, then the muscle isn't functioning as it should. Cardiomyopathy, that's where there's dysfunction of the muscle itself in the heart. High blood pressure, sometimes if the heart valves aren't working like they should, right? I know you guys think the foundations and the blood flow through the heart. If one of those valves isn't working how it should, that blood's gonna get backed up and it's gonna cause more, that pump's gonna have to keep pumping harder to keep pushing that blood back where it should go. Pathophysiology. So normally we want the ventricles to pump an equal amount of blood. If it's more, like it can't handle that amount for whatever reason, right? Maybe it's because the muscle itself has stress or damage from like a heart attack. Maybe it's because, especially if you think of the left ventricle, if there's high blood pressure, that left ventricle has to keep pushing harder and harder and harder to overcome that resistance that high blood pressure is causing. Now, if I go to the gym and I lift weights every day, what's going to happen to my muscles?
They're gonna get bigger.
They get bigger and they get stronger because that's what my body's saying they need. When my heart, that left ventricle, is having to push harder and harder to overcome that resistance of the high blood pressure, what's going to happen to that muscle? It gets bigger. It grows stronger. It is a muscle. And so over time, as that muscle gets bigger, the space inside the ventricle actually gets a little bit smaller. It's taken up by that overgrowth of the muscle because it's just trying to get as big and strong as it can be to overcome that resistance to the high blood pressure. Usually the left ventricle is the one that fails first. And like we did the video was saying, if the left fails, the right's going to fail eventually too, because it's all part of one big system. So afterload, that's the force that the body or the ventricle has to overcome to pump out of the heart. I like this picture because I think that's sometimes I like visuals. So if you think about afterload, it's this left side of the heart. You know, he's pumping out to the body. And if there's a little like squeezing, tighten down, if there's high blood pressure, if there's damage to the vessels, it's having to push a lot harder. So the force that it has to push, that's called afterload. If you have a high afterload, that's going to increase the overall cardiac workload or the work the heart that has to do. I like these little pictures, and I think after I show the pictures, we'll take our break. So left-sided heart failure, I always think left lungs, right? Because the left side, it's all gonna back up and cause a breathing issue. Now, when you have, oh, the right-sided heart failure is one of the videos there, I really like that. I usually said the rest of the body, but I think that, let's see the video, I'll have to go look it up, because I really like the little word association. But the right side of the body is everything else, it's organs that are getting backed up. So the concentrating, the video talks a lot about the liver, but really all of the other organs, our stomach, our intestines, they're getting fluid overloaded and swollen. What happens when they're not able to function as well as we want them to? They start shutting down, or they just cause issue and you have decreased peristalsis, or the food isn't moving through as it should. Maybe they're getting constipated because they can't go like they should. So just the rest of the body is affected. All right, we'll talk more about this in a little bit. Let's take another break. I know. So if you want to leave campus or go somewhere, if you're choosing to stay, across the street is our meeting point. Is it still raining? I'm not sure. You might want a jacket. Not raining? Yeah. Oh, you can leave your stuff here. In a fire drill, would you want to leave anything here? No. If it was a true fire drill, we would take all of our stuff. I'm gonna leave it here. So you can choose to do whatever you would like to. Want to take some paper snacks, so you're welcome to. I hear, what's it called? Not ride buddies, but like ride share situations happening. Uh-huh, yeah.
Yeah, and it's a rotation, so.
You know what? I think I left, this recording. Awesome. We survived the fire, everybody. Oh, that sound's gonna be on the video. To all of you in video land, I'm sorry. So sorry. Okay.